Meet Natasha. She is here to meet with her rheumatologist. Natasha has been living with lupus for 10 years. She is currently pregnant, but she is nervous. As can happen very early in pregnancy for women with or without lupus, her first pregnancy resulted in a miscarriage in the first trimester. She is concerned that this pregnancy will have the same result.
I've been seeing a lot about neonatal lupus. Does that mean my baby will have lupus because I have lupus?
Great question. This can be confusing. Neonatal lupus is not the same as systemic lupus. Neonatal lupus is a description of the rash. Neonatal lupus is a rare condition that can develop when a pregnant woman tests positive for anti-Rho-SSA and sometimes also anti-LAW-SSB antibodies. Very rarely, about 2% of babies exposed to these antibodies can have a heart condition called complete heart block, where the heart beats abnormally slowly. Unfortunately, this condition is permanent. Also at birth, some babies develop a skin rash on the scalp, face, and around the eyes. In addition, there can be liver problems or low blood cell counts, but these symptoms typically resolve after a few months with no long-lasting effects. The good news is that you do not have these antibodies, so the baby is not at risk for heart block or other manifestations of neonatal lupus. Also, anti-RNP antibodies are associated with a rash in the baby, but you do not have those antibodies either. With regard to your baby developing systemic lupus, it's more common in daughters, and the risk of this is about 10 times higher than the risk for someone whose mother does not have lupus. As the risk of lupus in the general population is low, the risk that a child of a lupus patient will develop lupus is still only 1 to 5%.
Okay, thank you. That makes me feel better. I don't have those antibodies, right?
No, you don't. We already did these labs before you got pregnant, just to be sure.
Natasha goes on to have a successful pregnancy with the coordination of her rheumatologist, OB, and maternal fetal medicine doctor. They took a number of important steps to get there, which included Natasha's lupus remaining stable with minimal to no disease activity, and she was on medications safe for pregnancy at the time of conception. She and her doctor reviewed medications that were safe during pregnancy, her labs and risk factors for high-risk pregnancy, and she maintained close communication with her providers.